Good afternoon, everyone. Welcome to Dialogue on Diversity's 2021 Healthcare Symposium, Wellness, Science, and the New Insurance during COVID-19. Today, Thursday, May the 27th, 2021, 1 to 3:30 p.m. I am Maria Cristina Caballero, President and CEO of Dialogue on Diversity. On behalf of the Board of Directors who are present attending today, Claire Moreno, Olivia Carvajal, Yari Sanchez, Roberta Rincon, Cynthia Nazario, and others. Thank you all for joining us at our second Zoom webinar in 2021. The first webinar was on February 24th, 2021 on information technology and privacy, a novel era, privacy in the electronic age, who is watching and listening. Please let me call your attention that May is Mental Health Awareness Month. Mental health conditions such as bipolar disorder and depression affect up to 18% of America's population and is something that Dialogue cares deeply about, especially in these conditions that have been made worse over the last year's pandemic. Now a word about, what did I do here? First, a word about Dialogue on Diversity organization. It's 30 years work in the Washington national and world scene. Since its early stage, Dialogue has sought to bring close-up views and narratives of the social, domestic, and entrepreneurial existence of women in Eastern Europe and Russia at the end of the Soviet Union. We have since been attentive to women of the Western Hemisphere of our own cities, and especially in these troubled times. What are the characteristics of the good society that we aim for, and the trials and tasks of our audiences of interested men and women in an era of novel and disquieting historical forces? In addition to Russia, we were engaging in open dialogue at the World's Women's Conference in Beijing, in China in 1995. And let me review quickly the themes of our programming in the most recent seasons, stressing the themes of technical know-how, of an aggressive cultivation of a genuine diversity of traditions, history, and goals, of a commitment to the virtue of privacy, the architecture of an education from pre-K through college and more. In 2020, for example, we presented 3 webinars on targeted themes: women's lives, science and social justice, remedies for a battered society, the living is easy but not always, and our 30th anniversary celebration last year with a forum on entrepreneurship IT and the inevitable links to the delicate right to privacy. Today, this webinar will attempt to bid farewell to COVID and go on to building and rebuilding our nation and our lives. That is wonderful. Here are the areas of conversation today. The first one is on the politics and issues of vaccination. The second is on their cities and communities and decompression. And the third one is decompression, recovery of the post-civil world. Post-COVID civil war. Let me acknowledge our co-moderator, Olivia Carvajal, Esquire, a member of our board and the Women's Congressional Policy Institute. She will be helping us with the technical details of the webinar today, as well as conducting the question and answer sessions following each panelist's discussion. To let you know that we are recording today's webinar and we'll post it on YouTube and share on social media in the next few days. We asked today's speakers to give a brief description of their organization and their role as they address the topics for today's agenda. I will keep time as much as possible. We expect lively conversation with all the panelists and attendees. And so now let me turn it over to Olivia to explain the question and answer session as to how it will work. Olivia.
Thank you, Christina. So today we will be having questions and answers after each of the presentations. And if you want to ask your question, you may post it in the question and answer box, and I will be reading those questions out loud to the panelists. But you may also put the question you have in the group chat, and I will read those as well. And you may also directly ask your question to the presenter by raising your hand, and that can be found on your Zoom screen as well. And if time does run over and you aren't able to get your question answered, feel free to reach out via email and we will direct your question to the exact panelist to get you an answer. Thank you very much, and we look forward to a lively discussion today. And I will turn it over back to you, Christina, for today's program.
Wonderful. Now, well, we are really very much on time. Amazing. Our first guest and key speaker for today is Dr. Lois Lee, president, founder of Children of the Night. I have the pleasure of introducing her today. Dr. Lois Lee is the world's leading expert in rescuing child sex trafficking victims, and her pioneering work in this area has blazed the trail for academics, researchers, law enforcement, social service providers, and legislators across the globe. Her training and program materials in this area are in high demand. Dr. Lee holds a PhD in sociology and anthropology, a JD in law, and is an active member of the California State Bar. She is the author of The Pimp and His Game, 1973, which serves as the basis for law enforcement training in both state and federal court since the 80s. Dr. Lee is the recipient of countless awards for her groundbreaking work, notably prestigious President's Volunteer Action Award presented by President Ronald Reagan in the White House in 1984. She received the 1994 National Caring Award, and her portrait hangs in the Frederick Douglass Museum and Hall of Fame for Caring Americans in Washington, D.C. And Dr. Lee has been profiled on national television, including 60 Minutes, and her life portrayed in the 1989 CBS movie of the week entitled Children of the Night. Given the enormous importance of her research and experience, countries across the globe, such as Japan, Romania, Mexico, and Canada, have sponsored visits to implore her expertise to assist law enforcement in developing techniques on how to intervene in the lives of child sex trafficking victims. We are excited to have Dr. Lee with us today as she affords a close look at the harms of a raging and global trafficking industry.
Hello, I'm Dr. Lois Lee. I'm the founder and the president of Children of the Night. The Children of the Night team stays with our prostituted youth all the way, from life with a pimp to college and a family. We no longer sit behind a desk and wait for prostituted youth to find us. We go where our children need us, and if necessary, we accompany them to government offices for services. No rules, no waiting list, no expectations. We have accomplished psychotherapists, doctors, dentists, and other professionals who help us. We have opened our private test center for the high school equivalency exam. Our tutoring program has been so successful, we've gone global to reach young sex trafficking victims in developing countries. Our new programs have increased our clients by 90%. And our success rate continues to be 70 to 80% of permanent removal from prostitution. With your help and support, we remain strong.
So much for the invitation to speak today, Christina. I just can't thank you enough. This is a new opportunity for me because I basically am on the West Coast and globally, but I don't spend much time in Washington, D.C. I'm credited with starting the anti-sex trafficking movement, which causes me disappointment because the children I help, prostituted children, have been left behind by the middle-class anti-sex trafficking movement. It must be noted, young boys and young transgenders are rarely included in the anti-sex trafficking movement. The children with whom I work come from chaotic families characterized by chaos, domestic violence, substance abuse, and mental illness. They're often poor, uneducated, isolated from culture, left behind in school, rude, ungrateful, angry, varying cultures, ethnicities, races, and genders, and very sexually provocative, because that's how they received nourishment, attention, and some form of love. For these children, life with a pimp is better than life at home.
Mm.
There's nothing middle class about the children or the conditions from which they have suffered. I once asked a 13-year-old girl why she mouthed off to a pimp in a pimp bar, knowing quite well he would drag her into the alley, beat her, kick her in the stomach, and knock out her teeth. She said to me, because I knew then he would take me home and make love to me.
Oh.
When I found children, some as young as 11 years old, working as prostitutes on the street, I went to social services and asked them to put these children in foster homes. They refused because prostitutes, no matter what age, were criminals. I then went to juvenile hall and juvenile court judges and asked the same, and they refused because these children were not committing crimes against property, only crimes against themselves, and therefore did not warrant the expenditure of taxpayer monies. In the 80s, I became very involved in the Hillside Strangler investigation because I knew 2 teens who they had been tortured, strangled, and left nude on a hillside. Terror struck all women in Los Angeles because the police hid the idea that the victims were prostitutes. Despite a 55-man task force assembled by LAPD and the Los Angeles Sheriff's Department, there was no progress in identifying the Hillside Stranglers. One night, an 18-year-old heroin addict, madam, called me to tell me she sent a young girl to meet a man, and the girl never called to tell her she was safe. The man was not answering his phone, and the address had been changed. I called the operator who confirmed the man had called from a payphone. I asked the madam to ask the pimp to look through the girl's belongings to see if he'd left any indication of a changed address. He found it. I spent several hours first on the phone and then in the police station, asking the police to go to the location where the girl had been lured. They refused. And one officer said, "We're not sending a car. She's just a whore, and she just changed trick houses on it." I called an NBC reporter at 3 a.m. and said, "Get up, we got another one." He assembled a camera crew from NBC and went to the location to confirm what I had told him. The building was secured, her car parked in front, and still no police response. The next morning, she was found tortured, strangled, and displayed nude on a hillside. That girl was 17-year-old Kimberly Martin.
Oh my God.
KMBC, KABC, and KFWB joined me in pursuit of the Hillside Strangler. That morning, I announced on nationwide news, if you're in the prostitution business and you think you know who the Hillside Strangler is, and don't want to talk to the police, don't call them, call me. And I put my home telephone number up on national television. Instantly, I became a legend among pornographers, strip club owners, organized crime, massage parlors, madams, pimps, bail bondsmen, even the men who sold newspapers on the corners and saw everything on the street. The adult entertainment industry told me how Congress had changed the laws so the police could not arrest children for running away, and the sex industry had become flooded with children. They wanted out of their businesses, so they referred the children to me. From 1979 to 1981, over 250 prostituted children came through my small 2-bedroom apartment. Many returned to the street and then came back to me in desperation. I learned from them that in order to be effective, I needed to accept them for who they are and to help them unconditionally. Since that time, I've operated a drop-in center in the heart of Hollywood, street programs all over the western region of the United States, and finally a world-class 24-bed shelter home. Diplomats came from all over the world to see my work. We closed our shelter home after 25 years because new laws required shelters to report any contact with prostituted children to law enforcement. Those children were then interviewed by law enforcement, and if there was a pimp involved, the child was placed in solitary confinement in juvenile hall until she testified against the pimp. The pimp was sometimes a family member, a loved one, or a dangerous gang member who would kill their family. If the child did not reveal a pimp was involved, she was then placed in an inept foster care system, unable to deal with her problems, which resulted in, again, her running back to the streets. Consequently, prostituted youth ran from law enforcement by refusing to use shelters and foster care. Instead, they relied on social networks for a place to stay. When our prostituted youth told me they would no longer use shelters and they were going to go on the run, I said, wait, I'm going with you. I established a new program that was relevant to their current needs and offered case management nationwide and made our school available on the streets. From our headquarters, case managers provide children 24-hour services, 7 days a week. We rescue youth from pimps, help with medical services, public health insurance, Social Security, disability benefits, maternity housing, drug program placement, domestic violence housing, transportation, mental health services, psychiatric evaluations, or access to psychotropic medications, advocacy with courts, social workers, probation officers, resume preparation, job placement, access to vocational or trade schools or even community colleges, and applications for FAFSA, federally funded financial aid. We are ready and willing to help. Our free tutoring through Zoom tutors sex trafficking victims for the high school diploma, the first step in escaping the streets. The high school diploma enables them to enter the military or work in support positions in medicine or law, attend vocational or trade school, and even community college. Our students are unable to attend regular school because of extensive existing trauma and ongoing chaotic lifestyle, so our case management program dovetails with the high school diploma. The anti-sex trafficking programs, which is generating an enormous amount of government funding, helps teenagers who are pregnant, high-risk kids, sexually active kids, kids who were never ever recognized or receiving adequate resources in the first place. So all is not lost, but prostituted children are left out and they're considered too difficult to care for, and a fear of them contaminating innocent children is real. And the prostituted child says these programs are not for them. Prostitution, sex trafficking is not a disease. It is a circumstance, and the only commonality among its victims is the loss of sexual dignity. The difference between those who become prostitutes and those who do not is only differential opportunity. The prostituted child meets someone who introduces her to prostitution, usually a pimp or trafficker. The other child does not meet anyone involved in prostitution, so it's unlikely she will become a prostitute. It's easy to predict which infants are vulnerable to prostitution by simple hair follicle tests to determine drug use by the birth mother at the time of delivery. Many children after birth are taken to crack houses and drug dens and sexually violated before they can walk. Many of their mouths are used to please men when they are infants because adults sell them for drugs. The prostituted child is defiant and often a willing participant in their own victimization. For instance, just yesterday, a prostituted youth had completed all of her tests for the high school equivalency except the algebra portion, called sobbing and confessed she returned to prostitution and is now with a new pimp. I knew she was waiting for judgment and a tongue lashing when I responded to her, "How are you doing on your algebra?" There was a long pause and she said, "Can I start tutoring again today?" I said yes, and I connected her to one of our tutors. She continues tutoring for her algebra with her cell phone and Zoom. When she completes her 1 hour of tutoring, she leaves the hotel to turn tricks at the truck stop. Her tutor came to me and told me her pimp wants to tutor for his high school equivalency and asked, "What do I do?" I said, "Tutor him. We will be able to reach more girls by tutoring him, and maybe he can develop skills so he will no longer need a pimp." We can only change the world in unpleasant circumstances with unconditional love, understanding, acceptance for people for who they are, and the education of everyone by including people from different social and ethnic backgrounds, different genders, different sexual orientations, and different circumstances in life. Only then will we be able to make great strides with equality and diversity. Thank you.
Wow, what a story. Thank you, Dr. Lee. I hope your schedule will allow you to be able to stay with us for the entire length of the webinar today.
Yes.
But can you? We hope that you can for as long as possible.
Yes, I can.
Wonderful. Let me turn it over to Olivia now to conduct a question and answer session with Dr. Lee, with attendees and whoever has questions from our panel as well.
Great, thank you. And if nobody raises their hand, I'm going to read the first question. You obviously have been close to the subject of child sex trafficking in America for decades. We're interested in your perspective. How have attitudes changed in the last 20 to 30 years towards the victims and the subject as a whole? And what hasn't changed and is still the same?
Wow, what a question.
Not a lot has changed.
Oh,
Well, we talk about them not being criminals and not being able to be arrested for prostitution. Law enforcement has found a way to put them in jail on material witness holds under the guise of it being for their own good until they testify against a pimp. We talk about them being excused for crimes that pimps make them do, but that's only if they testify against the pimp. And that's always been the case. We just call it different. There's a different language around it. The actions and the behavior is still very much the same. The attitudes about being a prostitute or whether it's a sex trafficking victim still generates lots of giggles from the football team and other boys and men. And it's still the subject of many, many jokes. Not a lot has changed. Women are still arrested for prostitution and placed in jail. And they're ridiculed for their behavior.
thank you.
Thank you. The next question is, do you think that Congress and state legislators are doing enough to support protecting young women for sex traffickers? And if not, what could they be doing better?
The legislation of Congress, which is a lot, is done without much forethought. It gains a lot of votes. Nobody's going to judge you for carrying anti-trafficking legislation, but very little consideration for the social impact and consequences on the real victims. There are so many bills on sex trafficking, oftentimes they contradict each other. And without a concerted effort of experts of sorting out all of these laws and figuring out a policy and guidelines, they're uninformed. It's uninformed legislation, and the social impact can sometimes be devastating.
Hello, can you hear me?
Yeah.
Yes.
Hi, thank you. Thank you very much. Good to see you again, Christina. And Dr. Lee, thank you for that presentation. Just a couple quick questions. One is in terms of the coordination among the states in the US, is there any significant effort on looking at how the sex trafficking that is moving across borders I should say, states that are adjacent to each other, and how to more effectively coordinate among them? I'm in the DMV area, for example, in Washington, D.C., Virginia, Maryland. So is there any kind of significant coordination among law enforcement or those who are involved with sex trafficking prevention to look at how they can do better jobs at that? And then the second question related to it is, do you see any changes in the centers of where sex trafficking in the US is moving from one region to the other or one area to the other over the last 10, 20 years in terms of the level of activity and the scope of it there? Or has it pretty much remained the same around, for example, the major urban areas or the border cities of the country?
Well, the movement from state to state was changed by Honorable Janet Reno. I don't know how she got lost in the whole sex trafficking movement, because she was the one who really started the use of federal laws and federal prosecutions for anyone who moved a child from one state to another state. And that has been very, very effective. the movement from state to state or from region to region is only dependent upon one thing, and that's law enforcement activity. To give you an idea, if there's going to be a crackdown in a particular area, and there frequently are when there's conferences or diplomats coming into town or political things happening, you'll see that the streets are swept and the prostitutes are moved to another state, you know, so that they can work, which is always kind of, to me, I find is an interesting phenomenon. I was called in to ask, was asked by NYPD about what to do about a sporting event because they were not seeing the number of arrests for child sex trafficking that they thought they should. And I explained to them the reason is that you deploy all of your officers to the actual event, which is very expensive and has lots of security. No pimp is going to work his girls in the middle of that. It's just too dangerous. But if you deployed all of your police officers to the Motel 6s and the areas around the sports activity, you would have lots of arrests. But of course, they're not going to do that because their job is to protect the tourists.
Oh, okay. Okay, so they don't have a strategy for the focus of where the activity is. It's more to.
They don't have the resources. They just don't have the resources.
Okay. Okay. Thank you very much.
Thank you.
Thank you. I think we're going to try to go back with Manuel. Oh, looks like he's still connecting to the audio. We have a question in the chat that says, how do you work with parents and schools early to create awareness about this critical issue?
I believe that there's a lot of awareness going on in the schools. And I believe that there's sometimes too much awareness. I was invited a couple of years ago to speak to a very prominent girls' Catholic school. And the headmistress was terrified, but the students demanded it. And I explained to the kids that the likelihood of them ever meeting a prostitute was not very high. And the likelihood of their mother knowing a prostitute was not very high. And the likelihood of their father knowing a prostitute, well, if he did, he'd have a lot of explaining to do. And but that they all will meet friends. They have friends who will encounter divorce, molestation in the home, suicide attempts, drug use, and that they need to be able to do something about that. And that the concentration should be before someone's actually involved in prostitution or affiliates with a dangerous character that could enter them into prostitution, is to develop a knowledge and a database that can be used on school for suicide prevention, drug intervention, self-help programs. And that's really what needs to be done. I don't believe that the number of children who are actually prostituting is not that great, which is one of the reasons it's taken so long to generate money. It's not as high as the number of kids who are going to commit suicide or overdose on opioids. It's really been exaggerated. I don't believe in scare tactics, and there's certainly a lot of other problems that can be dealt with early on.
Thank you. And we have another hand that is raised. Rachel, you may ask your question.
Thank you. Can you hear me?
Yeah.
Yes.
Awesome. My name is Dr. Rachel Hendricks Stirrup. I'm the Health Policy Counsel at the Future of Privacy Forum. And first of all, I want to seriously, congratulate and commend you on this work. I think, this is a huge gray area that a lot of people are scared to penetrate. And I think what you just described is, what success looks like, I would hope, in this area. So first of all, thank you for the work that you're doing. I have a bit of maybe a two-pronged question. First off, as you provide services to child victims in this trafficking scenario, how do you achieve success with regard to getting the mental health care services that they need? Because in general, in the United States, our mental health care system is way too fragmented. It's broken. It doesn't work, in my opinion, as someone who's, who has observed, many close close loved ones try to navigate it. I mean, it's just terrible. And I hate to say it, you know, like this, but I'm just going to call it what it is. So how do you successfully navigate that system, or bring that system to your organization to make it so successful? And how can you be probably a model for the larger US mental health care system? And then I guess my second prong along this question is, how have you successfully navigated the privacy and information sensitivities that accompany the stories of the children that you're working with? You know, I would imagine they don't want their past to follow into adulthood as they move on in life and graduate from your program, so to speak, and, you know, try to put the past behind them. So how do you successfully navigate some of the privacy sensitivities to, you know, for the lives that you've touched?
Yes.
I'm trying to remember what the first question, the mental health. Well, Children of the Night is strictly supported by private donors, and it was a very hard way to go, but have been very, very successful with it. And what's come with that is bringing people in all kinds of professions who want to help. And so we are very fortunate that we have very successful professionals who work with us for free, provide pro bono services, and we don't have to depend on county funded or state funded or government funded, where sometimes one size fits all. So we have a group of private therapists all over the United States who are willing to take our clients pro bono, and we make sure that we have a copy of their malpractice insurance, their identification, their license, and that we make sure the insurance is current. And if our kids don't like that therapist, we don't have any problem in terms of just changing it. We also have been tied to Pepperdine University and their clinic, which is supervised by very accomplished psychologists, and their students would see our kids on a weekly basis. We also are affiliated with Fuller Theological Seminary, who has a clinic who, for our kids who are severely, have severe learning disabilities or severe mental health issues, they perform a 2-day analysis. It takes 2 months to complete their reports. And they have also, then they write a letter that we can walk into Social Security and get benefits almost immediately. They have data of many of the children who live in our shelter, and now 5 dissertations have been completed on the data. We found out some very interesting things about our children who are prostituted versus children who were just sexually abused. In terms of depression was less among prostituted children. Their resilience was higher. And I don't really want to quote all the data, but it's something that I'm really trying to promote and make available so that people understand. This is data done by kids who voluntarily went to them, who wanted to know what was wrong with them. It's data that doesn't exist anywhere else in the world. It's not interviews that were done in jail. There was no coercion. And so that's very interesting. The second, so we have a lot of resources. The second question was in terms of privacy. We delete all of our records on anyone that we've served that we have not had contact with for 3 years. And that the 3-year requirement is something that's required by the Department of Social Services when you're running residential care. So there's no paper, there's nothing in the computer. We help kids expunge records, we help kids seal records. One of the real problems is we have kids now who are adults who have completed nursing school, and they've completed other kinds of professional school, and they cannot clear their Department of Justice background check because they were arrested for prostitution as minors. When they were arrested as minors, the pimp had given them a fake ID. So once that happens and you're arrested, you're always tracked under that name. The only way that they're caught is when they run the fingerprint clearance. So, in talking to, I was very active in trying to get a legislator here in California to apply, automatic sealing, where you just would fill out a piece of paper, a police report, show that that's not you, even though your fingerprints match, your birth certificate, evidence that you are a minor. And an assemblyman was carrying the bill, and we were opposed by the public defender's lobby in Sacramento, if you can believe that. So what maybe, they say they're doing today, which they don't really do, unless you testify against pimp, it does not apply to girls who are in their 30s who did something when they were 15. So we continue to fight that. And oftentimes they have to find other professions despite the fact that they completed school. And that's something I'd really like to see Washington address.
Mhm. Mhm.
Thank you very much. That was a really insightful answer, and I think it
Thank you.
certainly gives me a lot to think about, and I'm sure others on the call. So thanks again.
Thank you.
Okay, Manuel, we're going to give you one more try with your audio. Are you able to ask your question now? Can you hear us?
No.
No. Sorry, Manuel, I'm going to lower your hand and you can put the question in the chat if you're able to do so. And I do not see any more questions. Nope, I guess it's back to you, Christina, then.
Hey, it looks like all the questions have been answered for so far, and hope Manny can send it off in the chat so we can answer the question he had. Well, I thank Dr. Lee for your devotion to the cause of children of the night, children lost in the night, as trafficking is such an important issue in our community. Dialogue on Diversity would like to partner with you and the Children of the Night program sometime soon. And we thank you for your presentation.
Thank
and
you.
Delighted that you might be able to stay.
I plan to stay.
Okay, I think there'll be more questions a little later from some of the folks that are coming later. And so I have the next session at 1:40, exactly at the time that we have. Next up, I would like to introduce Dr. Henry Pacheco, physician, Pacheco and Company. He will take up the topic of the politics and the issues of vaccination. Our webinar now turns to a detailed exposition of the ravages of COVID sickness and the attempts to pursue to abate the contagion. Dr. Pacheco's particular concern is the reluctance of the Latino community to seize the advantage of a simple inoculation. Let me turn it over to you now, Dr. Pacheco. The floor is yours.
Good. Well, thank you so much, Ms. Caballero, for the invitation and to Dialogue on Diversity. I really appreciate it. And I can't wait to hear the other speakers. Dr. Lee's presentation was incredible. It's a terrible topic that we have to deal with. Yes, well, my topic is, reluctance of Latin Americans to vaccinate against COVID-19. And I still wonder how much is really reluctance and how much is barriers. So maybe a little exploration, some comments from other folks. We have to clear this up a little bit more. But let me just start by giving a brief overview of the epidemic. We may not realize that we're in the middle of probably one of the deadliest U.S. Public health crisis in this century since the Spanish flu virus, probably 1918. And it's caused by a new virus from a known family of viruses. So it's a new member of the family of the coronaviruses. The coronaviruses have been hitting human beings in the past. You may remember the outbreaks of SARS, severe acute respiratory syndrome, and MERS, the Middle Eastern respiratory syndrome, which caused significant pneumonia, difficulty breathing, and high mortality. But those outbreaks were contained, and they didn't expand beyond the limited territories. And now this current virus, it's believed to be originating in Wuhan, China, but the exact source is still in debate. It's not really known. But we know that scientists have been studying the coronavirus families for years. That's an important point to know because it addresses some of the questions about the vaccine. just a little bit on the impact of the COVID pandemic in the United States. So far, there are, and my numbers will limit themselves to the United States. So far, there's 33 million cases of the disease in the United States, 33 million, and about 590,000 deaths. That's in about 16 months. Now, you know, if we compare that to the HIV epidemic, which started 40 years ago, there have been 700,000 deaths. And you know how much we feared, and we still fear HIV. But if you compare those two, in less than about 16 months, there have been over 500,000 deaths related to COVID. So it's pretty dramatic, mind you. And in other countries, it's horrible. So, you know, I'm sure you've heard of the news, what's going on in Brazil, and what's going on in India, lots of parts of Europe. It's been terrible. Now, in the United States, you know, up to 130 million adults have been vaccinated. That's believed to be, you know, about half the population that needed to be vaccinated as of June 2021. This, you know, is a decent number, and we're getting better. But, you know, ideally, that number, I mean, we should have a, you know, I think it's about 60%. We should have about 65, 70% in order to have this so-called well, what is called herd immunity, which is a point at which enough people have gotten the virus either through vaccine or through the natural disease, so that you know, there is some protection from that, let's say. Well, in general, just a quick review of vaccines. In some ways, it feels like this is something new, but you know, vaccines have been used for over 100 years. You know? And so it's nothing new. We all remember our childhood vaccines, at least I do, and adult vaccines. So vaccines have been around for us for many years. Millions of children and adults are routinely vaccinated annually. You know, what do the vaccines contain? They contain weakened, either the virus or bacteria, either a weakened virus or bacteria, or a harmless piece of this germ, like it is the current vaccine, or a kill virus or bacteria. That's what usually they contain. They induce, vaccines induce our immune system to develop antibodies, defenses, so that when we're exposed to an individual or we're exposed to the bacteria or the virus, our body's already has our defenses ready to put up a fight and win the fight. The COVID vaccines are newly developed. There is 3 in the United States being used: Pfizer, Moderna, and Johnson & Johnson. You know, some people suspect, well, geez, how did they get developed so quickly? If it takes years to be, you know, months and years for a vaccine to be developed. Well, first of all, as I mentioned before, scientists were already studying this vaccine, the coronavirus. They were already being studied in detail in labs. Second, modern technology, biotechnology, allows us to reproduce these viruses, reproduce these vaccines, and to prepare them much quicker than it used to be. In the past, you have to grow them in eggs, you have to incubate them, and not anymore. The other thing we should keep in mind that vaccines are really preventing us, you know, as we speak, from very deadly and very serious diseases. I mean, there is a whole list of horrible diseases that we have actually forgotten about them because of vaccines. You know, you have cholera, diphtheria, hepatitis, the flu, mumps, whooping cough, tetanus, polio, you know, smallpox. I remember in my childhood seeing 2 or 3 people severely scarred. I'm Bolivian, so this is in South America. You know, I probably saw when I was a child 2 or 3 people severely scarred by smallpox. And, you know, as I say, those are the lucky ones because those are the ones that survived. A whole host of others died. I also have 2 relatives who have used wheelchairs because they're paralyzed from the waist down as a result of polio. And as you know, smallpox has been eradicated from the world due to effective vaccination programs run internationally. And polio has been mostly eradicated in the Western world. There are cases of polio still popping up in places like Afghanistan, Pakistan, places where vaccination has been very difficult. So, we have a tremendous tool to protect us from these diseases. Not to mention rabies, tetanus, very hard to survive that. So, we routinely get that vaccine. Now, as soon as vaccines developed in the world, there was resistance. So vaccine resistance is not new. In the 1960s, the anti-establishment culture started challenging the need for vaccines. They challenging the question of mandatory vaccines. Also, the number of vaccines multiplied tremendously. As a kid, you'd get, you go into a visit, you get 3 shots, on one arm, 2 on the other. It just seemed like a tremendous number. And also, in the 1970s, you had the patient rights movements. They started questioning, the healthcare system, and then you also had dissident doctors, and then there's also this fear of chemicals, additives to the vaccine that people started questioning. Does it have this, does it have that? And there was the emergence of vaccine celebrities who fueled the vaccine resistance. Many of the celebrities had no background, no background in medicine, in public health. They were just celebrities who were well known and who fueled this this vaccine resistance. So it's not surprising that when COVID vaccination came around, this effort would have to go through the same process of significant resistance. However, there were additional elements, I believe, that have been added due to the times we're living. There is still now a number of professional anti-vaxxers. Many of these folks profit from their efforts. They sell books, they sell cures, they give talks that they get paid for, and this and that. And somewhere I read in the internet that there's about 12 known individuals who are responsible for the overwhelming majority of their anti-vax points of view. Now, what happens is that social media and just the internet have an incredible multiplying effect. Well, one of the things is that there's always been some degree of politicization, but the politicization around COVID itself and the vaccine has been incredible. We've all seen this incredible thing developing in front of us. And that has fueled the doubts, the hesitancy about vaccine. There's been a lot of misinformation, myths, incredible conspiracy theories, that have appeared in social media, in radio, in television, as soon as vaccines were announced. One favorite tool that I see that I don't know if they do it willingly or that's just a technique, is that I watch the news and they'll pose a question. The reporters will be reporting and said, I've heard that the vaccine does this. And the other reporter might be there will say, oh, really? Yeah, yes, that's what I've heard. Well, and they just leave it like that. They leave it as a question. Well, geez, they could have just found somebody who could answer the question and say, no, that's not happening, or yes, this is happening. But by just placing the question, already plant doubt, and that gets multiplied. And everybody starts repeating and say, oh, I heard on the news that it might cause this, it might cause that. That you see that in the press, and of course the press is out to sell, their stations, their newspapers, everything. So they multiply these messages that then cause more viewership, I suppose. And the politicization, of course, is that we've seen politicians at the national, state, and local level get involved heavily in these issues of vaccine, either on one side or the other. And they were absurdities. These folks will be talking about whether it's real or not. You have tens of thousands of people dropping dead around them in the United States, in the world, and they're still coming out with the message, well, we don't think it's real, maybe it's just a bad cold, or it's like the flu. It's just a vacation from reality, However, these are folks that have authority. People respect their opinions. So when Joe Public listens to them, they say, oh, there might be something to it. Look, this high official, either in the White House or in Congress, is saying this. There were also unproven and harmful medications that were peddled at high levels. We had incredible examples of not just false cures, but harmful cures that were suggested at very high levels of government. That is bound to bring a lot of confusion. So, the resistance and skepticism, obviously would be fed and would be extended to this vaccine, COVID vaccine. As I said, many politicians became sources of disinformation, untruths, myths, in various levels of government. Of course, then the shutting down of businesses and restaurants and venues caused much strain among owners, definitely, and patrons, which fueled a lot of political and social discontent. So if my restaurant or my bar was closed and the mayor was a Democrat, then you would say, there's a Democratic conspiracy against us and this and that. And so it became a political ping pong. You could ask somebody what their point of view was on the epidemic, on the vaccine, and you could actually tell what political party they belonged to. The stresses on us have been tremendous, but once again, we are facing one of the greatest threats to health in over 100 years. So it's a serious situation. We can see the number of deaths. And of course, foreign countries also found a way to manipulate American public opinion. They also injected doubts. They also planted doubts with incredible multiplying effect of social media, Facebook, Twitter, all of these places where people go to routinely look at things. Well, they found a lot of misinformation there, and some of this planted by foreign governments seeking to destabilize Western democracies and other countries and other vaccine producers. Well, so now back to Latinos. In Latinos, is it a question of a hesitancy, or is it mostly a lack of access? There's no doubt that many Latinos, have listened to these scary myths and things like that, and are, somewhat fearful, somehow hesitant to get vaccinated. There's no doubt about that. But, many polls and surveys are all over the place. Some say it's 30%, 20%. And, I've seen some that hesitancy is as low as, let's say, 9%. It's a wait and see attitude. Well, let's see more people get vaccinated to see if there are any side effects, then I'll go. But, in my opinion, the opinion of others, it's rather a lack of access, and many of the situations that are typical for, common to Latinos, which is, they just don't know where to go and how to get vaccinated. I myself had problems navigating the websites of our state vaccination center. It was a little bit of a problem. I couldn't figure out, they also have to register. So the websites of many health departments are very wordy and difficult to navigate. They'll have in one corner, say in Spanish, when you click on it, the title says, in Spanish, will say, this is where you can register vaccinated, and the rest is in English, for example, And it was just very, very difficult to navigate. They're also unaware, many are unaware that the vaccines are free. They don't know how much it is. Many lack transportation because, at least in the past, there were particular places only that were providing the vaccine. Some Latinos also have concerns about requests for ID and names. There are some Latinos, a few, that are undocumented, and they're a bit nervous about that. And of course, Latinos have been bombarded by conspiracy theories and myths and alarmist reports. In radio, you hear jokingly some of this, say, oh, I've heard this, oh, I've heard that. They just plant these things, And of course, it's logical to say, oh, really, there could be some truth to it, So vaccines are wary of, Latinos are wary of vaccines for various reasons, but it's heavily fueled, I believe, by this misinformation and by real concerns. For example, I went to a restaurant, I asked somebody, the waitress, whether they were got vaccinated. Said, no, because, I heard that after vaccine, you have some aches and pains, might be sick for a couple of days. Well, I'm going to have to do it when I'm kind of close to vacation because I can't take, 2 days of work. and which makes sense because, you know, every day that they lose work, they lose money. So to overcome vaccine hesitancy among Latinos, well, we have to neutralize the spread of this misinformation, myths, and falsehoods by promoting ideas and by credentialed and believable speakers that are recognized health authorities. As I mentioned, for example, I am a doctor, and just because I'm a doctor, you know, don't take my word for it for what I'm saying. You go to the CDC, go to the health department, because the truth is that there are many MDs and other doctors who are saying absurd things. Why are they saying that? Because they're ignorant? No, they're selling something, you know, or they're selling themselves. So just because you heard a doctor say this, you know, go to the family physician and call the health department, call the CDC, and later I'll give you an idea. And so we have, you know, to overcome the hesitancy, we have to use the same tools, the same media, and it's been used, you know, people are Latino agencies, Latino experts, health departments are putting messages in Latino agencies, you know, Twitter, Facebook, and all this other social media places, also in the news. And, you know, you have to put up posters, and you have to use the little local papers that every Latino community has, have to put ads in there or commentary on, by people who are well informed and have the goodness of the Latino community in mind. And, you know, we have to avoid giving voice and to self-promoting celebrities and experts who are, or gurus who promote their own beliefs, their own opinions, and without citing any evidence, you know, and they themselves lack the credentials. The idea is, let's stick to known places, the CDC, the NIH, the state and local health departments. With Google, you just put, you know, whatever your state is, Virginia State Health Department, you'll get to it, you know, in Spanish, in English, in any language. So we have to go to those sources. You have to go to your family physician if you have one. You know, many Latinos don't have a regular social care. They don't have a family doctor. They can just call and you know, and say, you know, what do you think about this? Community health centers there's thousands of them around the nation. Excellent sources. Community health centers have been providing healthcare to Latinos for decades, and they're staffed by caring doctors. Doctors of every origin, you know, let's say national origin. There are Indian doctors, there's Anglo doctors, there's Latino doctors, African American doctors, Filipino. All their mission is take care of people who are underserved. Community health centers are a great resource. And, you know, there's no doubt we have to dismantle some of the structural racism. You know, there's still a lot of websites that are not translated. It's still a little bit difficult for a non-English speaker to navigate. So those things have to be, you know, identified and dismantled. And, you know, we have to promote individual responsibility. It shouldn't be up to the state to make sure we get vaccinated. It should be up to us, up to our families, up to us as individuals, and to build the self-reliance among Latinos to say, you know, we have to take care of ourselves. So we are going to search where to get vaccinated. We are going to search what the truth is. So by exercising that individual responsibility and self-reliance, we will you know, eventually overcome this last levels of resistance. You know, the final fact about COVID is that it's unquestionably a real and present danger. You cannot say, oh, geez, it's a myth, because you see millions around in the nation and in the world dying. Secondly, hand washing, masks, physical distancing are effective in preventing the spread. These are not rumors. They have studied the effectiveness of masks, and yes, they do work. They have kept us from, you know, from those numbers, instead of being 500,000, from being, you know, twice as much, because Americans, people living in the United States, have exercised the use of masks and physical distancing and hand washing. Those work. And let's not forget that an individual with little or no symptoms can still be carrying the virus and infect their loved ones. They can go, you know, home and infect you know, their older adults, their grandparents, or their children. So the fact that you're young and strong, you don't have any symptoms, is still, you know, is not good enough. So, and you know, we have to realize that COVID is deadly, especially to older adults and those with coexisting conditions, such as Latinos that have a lot of diabetes, hypertension, and obesity, those folks do worse when they get infected. And Latinos work with the public a lot. They work, in restaurants, in outside as teachers, as nurses, as in the service industry. So they're exposed to the public a great deal. And then let's not forget that COVID causes persistent and often very serious sequelae among those that have survived. So they have survived, but now they've got heart problems, kidney problems, even some mental problems. So it's a serious condition, even if you survive it. And we know that to achieve herd immunity, that immunity as a community, we need close to 70% of the vaccination of the people to be vaccinated. Then we'll feel a little bit better. And lastly, the vaccines in the United States, Pfizer, Moderna, Johnson & Johnson, are safe and very effective. Pfizer and Moderna have 94%, 95%, or even higher effectiveness in preventing people from getting the disease. Johnson & Johnson is a little bit lower, but if you have a choice, if you don't have a choice, I'm sorry, it's Johnson & Johnson, I would take Johnson & Johnson, because any protection is better than no protection against the disease that's very, very serious, very deadly. That's my brief message. I appreciate giving the opportunity, and I hope that we get more and more of the leadership getting out and bringing the news and the strategies to Latino populations scattered around the country. Thank you so much, Ms. Caballero, for giving us the chance to speak.
Oh, wonderful. Dr. Pacheco, thank you so much for taking up a very difficult question, complicated issue in COVID and policies around it. And now let's turn it over to Olivia for question and answer.
Thank you. I don't see any hands raised, but I see one question in the chat that says, is there a way to stop the fake COVID information that comes from apps like WhatsApp that affect Latinos receiving the proper COVID information?
Well, there's really no way to stop it. There have been, if you listen to the news, there have been some efforts of trying to legislate, but you can, there is, the problem is there's a point at which, then there comes freedom of speech, right? So there's no way to really stop it. You can't prohibit it. Otherwise, people will start prohibiting all kinds of stuff. But what we can do is neutralize it by having the same amount, the same intensity from known people, from influencers, to also speak up. I mean, just as an example, the other day I saw a picture of Miley Cyrus showing that she got vaccinated. Miley Cyrus is an influencer among young people. So if she got vaccinated, it must be cool to get vaccinated. We got to get the same amount, the same intensity, and using the same media. This is the only thing I can think of. Sort of censorship, and I'm not sure we want to get that.
Oh, wonderful. Thank you so much. And I guess no more questions for now, huh?
I do not see any more questions.
Yeah, we might be getting some for later on, but now we've got our next speaker, just on time. I don't believe it, on the second. Our next speaker, Jackie Reyes Yanez, Director of the Mayor's Office on Latino Affairs, takes up the topic of cities and their communities. Jackie Reyes Yanez has perhaps the closest unmediated view of the COVID virus and that can destroy and the precautions that will minimize the damage. She is Director of the Office of Latino Affairs, aiming in its day-to-day work to produce effective skills among the city's Latino entrepreneurs, to foster collaboration among the other ethnic groups while celebrating the flourishing Latino cultures in our favorite district. Jackie, the floor is yours.
Thank you. Can you hear me? Okay, I'm muted because I usually get into this new era of telecommunication. But thank you for that introduction, Cristina. And I agree and totally agree with it. Dr. Henry Pacheco and many things that he was saying. Yeah. I have lived it through the whole pandemic, even when we didn't know what was coming on. Mm-hmm. And being the person that dealt with the Latinos here in Washington, D.C., I remember very vividly the first Latino that died.
Oh my God, yes.
Through the COVID. he didn't want to get out in the ambulance because he was afraid that immigration status was going to be asked. So we knew that we were hitting something unknown, and thank God for Mayor Bowser for her commitment, for all of the residents and all the inhabitants here in Washington, D.C. So many of the topics that you have, Dr. Pacheco talked about, the influencers, the myths and the things that is very on point. So I'm glad that being part of this for this group that, and you're putting this stage for us to come in dialogue, because some people don't know. Yeah. And they have like, okay, if you keep hearing, just like the fake news is spread, we should be also ambassadors of the facts and the things that are happening and that are affecting our community. So the more that we talk, and this is my first time hearing Dr. Pacheco, and I was like, wow, and I always reference also to the word of Dr. Huerta here, and we have partnered with him tackling the fake news and the fake things that are happening. Even Johnson, I just came right now from a vaccination on a construction site. We're taking the vaccination to where people are. So, and people were telling me 600 is a big site here in Washington, D.C. The old headquarters of Fannie Mae, and the workers, they still didn't get vaccinated. Most of the 600 didn't get vaccinated, and they were doing the Johnson & Johnson. And there's the gentleman saying, oh, I'm scared. And I'm like, well, you're not a woman and you're not in the age range. So come on, let's go. Let's get vaccinated. So he get vaccinated, So it's just like having that one-on-one, it works wonders. So having said that, for my introductions, I would like to say, I think I said enough about Mr. Pacheco, because I came in and I was just listening to him, and I agree with everything he said. And he's from the National Hispanic Council of Aging. So thank you for all that. But a little bit about my office. So for the ones who are all around and all the other presenters here, Dr. Lewis, Dr. Randy, and Olivia, we have been working with her a lot. But I'm gonna say a little bit about the office, and I don't know if you have, Olivia, the PowerPoint that we sent?
Yes.
So we can share that. So we are here, if we can have so a little bit overview of my office. We have been the Mayor's Office on Latino Affairs. I serve as at the pleasure of the mayor, and we are one of the only offices at national level that I sit in a cabinet level and I advise the mayor in initiatives affecting providing services to the Latino community. Since 1976, the Mayor's Office on Latino Affairs has served the Latino community in the District of Columbia. The mission of the Mayor's Office on Latino Affairs, better known as MOLA, is to provide the quality of life of the district Latino residents by addressing the broad range of social and economic needs through the strategic management, public and private partnership, expertise in policy, community relations, civic engagement, and community-based grants. We're gonna go next for the DC Health Recommendation Guidance as well information response to the COVID-19 recovery plans. Please visit the coronavirus DC at dc.gov. This is what I tell all the residents in Washington, DC that are Latinos. Please visit that website, because you're gonna get, the mayor has composed a lot of people that are health experts on this. I am not a doctor. So please, I refer everybody to go to the coronavirus. That information has been verified by the health experts that the mayor has put on. So that's what we have been doing since the pandemic last year. But the Mayor's Office on Latino Affairs efforts since the pandemic, we have been on the street. We didn't never close the office, because everybody needed to, they were afraid, like I mentioned at the first of the panel, that so we needed to keep the office open. We answer our phones from Monday through Sunday from 9 a.m. to 5 p.m., 7 days a week. So people that didn't speak the language, and I'll refer also piggyback to Dr. Pacheco, they needed to hear somebody that spoke their language and explain to them what was going on. You know, the kids were not going to school. Do I have to go to report to work? Is my employer making me go to work? You know, do I have the PPEs available? All of that. Throughout the pandemic, we work every day. We serve more than 70,000 constituents through the pandemic since March last year. 25,000 families served throughout the district on food distributions. That was a big task for us. We came out to different parts where the Latinos are, churches in Ward 1 and what is called Mount Pleasant, Columbia Heights, and Ward 4 up in the Brightwood area. And we also had a special program, and we served 1,847 constituents provided with first doses of COVID-19 vaccinations. That we did it through churches with working with the mayor's office on religious affairs. So we used a trust messenger church called the Sacred Heart here the first time. And one thing that we learned with the COVID is Latinos, we are not very computer savvy. So, you know, that first faith base, what we did is take the appointment out of the way. And we did a campaign. We don't check on immigration status. 450 people came out the first time. After that, the mayor said, no more appointments in Washington, D.C. We need to get the people, we need to get the vaccines where the people are, and we need to get all the barriers down. Yeah. So we have done that. We did distributions of PPE materials. We also got creative with the masks. And we have masks. We have young women that they were left without a job. So this is one of the masks that they I don't know if you can take me out like this. You know, bad people that didn't have documentations. What we did was, we can go back to the slide. What we did, reach out to those 9 women, give them all the supplies. Then we bought the mask for them, you know, and then we gave the mask out at our event. So, you know, we got creative and we have 9 persons, and we call that El Rayo de Esperanza, a light of hope to our Latina women. So that was one thing that we got creative with that. Next slide. That's it. So we also, our seniors was a very vulnerable community. So what we did, we didn't want our seniors out on the streets. We took the meal programs to their doors. That was, we worked with our main providers, Vida Center and Casa Iris. And then if we had individuals, we will take that food to them. The COVID-19 awareness, we distribute information at risk vulnerable populations to ensure knowledgeable seriousness of COVID-19 on public health precautions. We reach out to more 45,000 constituents engaged during the time period. And you saw me and in main media outlets, newspapers, combating the fake news and the methods that they were spreading out in the community. Like, people didn't want to wear the mask. You know, why should I wear the mask? And it was just a lot. So I was in my staff at the almighty 10 that we have. We were in every single community platform so we can engage our community. In the Mask Up campaign, the mayor, we did the Mask Up. Everybody was doing the Mask Up campaign from the mayor and all the cabinets. So we supported the MOLA, supported the mask mandate, social distancing requirements. And I will refer back to Dr. Pacheco with the language access. Everything that the mayor have done, we have translated as human possible. You know, all the alerts, we have tried to put out everything in Spanish and the other 6 languages that is mandated by the Language Access Act in Washington, D.C. So, but if you go to the coronavirus.dc.gov, you will find everything that has been translated, and the COVID-19 registration testing site, and also now that we have the state DC applications where we are paying 1 year prior of rent and three months in advance. So that has been translated also. So putting all of this in the language that they will need and the cultural awareness that the people will understand. We have translated more than 1,000 documents throughout the pandemic. Next slide. And we had increased our free distributions throughout the pandemic. We're 147. We have now that we are going, so what is going to happen post-COVID? So we are doing Zumba series. We are moving around. The campaign is called Somos Salud. But in that Somos Salud, we have increasing like Zumba series. We're going to get chefs, see all of this food that we give out. We're going to bring chefs so they can help us, cook healthy for our families. Religious, so we have done that in Brightwood in Ward 4, Cardoso in Ward 1. Religious spaces, we use our churches, our trust messenger spaces. So we have partnered with this Central Kitchen, Capital Food Bank, Francis on the Hill. If you have or any resource, believe me, I won't say no. I don't believe on leaving anything on the table. So I will take you in any idea that will benefit the Latino community. We are on it here in the Mayor's Office on Latino Affairs. So we have served more than 25 families through our food programs in the district. We have shared critical public health and public policy information in all distributions, including COVID-19 testing sites, vaccinations, these areas. So what we have done on the food sites, we not only give food, and like I shared that we're gonna be incrementing, like having local chefs to come and help give ideas on how to use the food, but also we partner with our other departments, such as the Department of Motor and Vehicles. They were like, they didn't know how to doing the backlog, and they didn't know how to do that. So we bring the other agency, sister agencies, so they can talk while they're getting their food. Next slide. And MOLA efforts during the pandemic. MOLA have worked resolutely with CBOs, district government agencies, local entrepreneurs to develop and produce and distribute PPEs. I explained that. Rayo de Esperanza, we did 5,000 masks. We provided to the community members and created by local female entrepreneurs. And like I said, we got creative with that. So we helped that out. That I'm very proud of that program. Medical grades were donated by CBOs. And so people, they reach out to us, different insurance companies also, they had money extra, like $3,000. They called our office and said, do you need somebody that will need cash? They will give gift certificates. We helped them with $100 each family. So that was a good. Also, the DC Health Link, they gave us masks. So mask was critical at one point, that everybody in DC had to be wearing a mask. So that DC Health Link can help us with 2,000 plus masks that were given out throughout our events. Next slide. Next. MOLA, we have provided, so people were not, they were having problems with the Department of Employment Services. So we deployed 2 of our staff members that spoke Spanish that went to the Department of Employment Service. And so we helped them with the claims. So we reinvested ourselves. That's why we came out with the pandemic. And that it was also a factor to our departments, how much is needed about having Spanish-speaking persons on staff. So we have more than 1,000 people on during the filing claims. Throughout the pandemic, also, we have provided technical assistance to our LEP and EAP constituents unfamiliar with the process of unemployment. We provided troubleshooting guide constituents through the applications, including FUA, PUC, and extended benefit program. So we became experts. We didn't know about what was going on the Department of Employment Services. We now know, we got trained. And so, because one of the things that we learned is people didn't know, and we learned together. So that was our mantra here. You know, we don't know, but we're gonna get, what the mayor has said is that we are in this together and we're gonna get out together. So we learn on how to give that one-on-one customer service. Next slide. Before and after, then throughout the pandemic, MOLA pressed forward with the 2020 census campaign. And that was a very big task for us because we were in the middle that everybody get counted, and we all know how critical is the census. That's how resources are distributed. And we did campaigns, we got creative on how to reach out to our constituents. We reached out to more than 15,000 constituents to our reach, giving out information, going to building to building, block to block. So we led more than 192 locations and events through 2019 at the end of the November 2020. And we were fighting against like the famous question 20 that they were asking for the immigration status. Again, we had to like tell the people that, and we were so glad that was taken out, but our people didn't want to get counted because of that one question. But we were out in the streets. Successfully, the DC County indicating 14% of the population growth in the district ensures greater funding investment in all aspects of the city. And we are at 14% of that population here in Washington, D.C. are Latinos. Next slide. Yes, this is our mighty old team, and we are out there, the mayor is out there. We are open 9 to 5 now, Monday to Friday, and sometimes our phones are connected to our cell phones. You can call our number 202-671-2825. That's a number that every Latino should know in the District of Columbia. So if they have a question, they can call us. And then you have comments, constructive criticism. We are here to serve our community. One thing that I want to share is that we also had our summer youth program, and we did a phone bank for 20 students during the pandemic that they reach out more than 1,000 people just to check on them. How are you doing? Like the most vulnerable, like just having a call that we're calling from the mayor's office on Latino Affairs from Mayor Bowser and Director Reyes. We want to make sure that you know about these services. So we made more than 1,000 calls to direct service, to connect to services. And we use that special program that are for young people from 14 to 24 years old that doesn't have documentation. So we got our kids to get to work during the pandemic. So next slide. And that is ours. That's our office. We are under the leadership of Mayor Muriel Bowser, who has mandated us. It doesn't matter if you have been here 5 minutes or 5 generations, you are going to be treated with dignity and respect in the District of Columbia, regardless of your immigration status. Mil gracias. Adios.
Adios, adios.
Okay. Well, thank you, Jackie, for your lively presentation about COVID now, how our Latino community fared and collaborative efforts with other ethnic communities in the DC area. And now Olivia will run the next question and answer session of the afternoon. Olivia.
Yes, it looks like we have a hand raised already.
Hi, this is Reverend Nixon again. How are you? Can you hear me?
Yes.
Okay. I have a question, I guess, and thank you very much, Jackie, for the presentation. I wanted to, as I listened to actually all three of the presentations, all three of them, one of the questions, I serve as a global vice president of our missions activity around the globe in terms of marginalized communities. But my question of each of you for Dr. Lee with the trafficking situation, and also with the COVID situation with Dr. Pacheco, and Jackie with in terms of the Latino community. My question is in terms of the faith community in each of your encounters with getting messages across to the population. How effective has it been in working with your leadership of the faith community in addressing each of the issues there? I spend a lot of time with our pastors in this country and others in India and Kenya and South Africa and some other areas of the globe, Haiti, helping to mobilize around the issues that are in those communities. So I wonder in terms of with the Latino community and with those who are dealing with trafficking and with COVID. I know in my own family, I have some of my family members are, for example, hearing messages coming from networks that are global, and some of them are faith networks saying, don't take the shots for vaccines. It's against the Bible. It changes your whole immune system. You won't be able to protect against anything else. So all those myths that you were talking about earlier, Dr. Pacheco, that are out there. And so my question, as I hear each of you, is across the cultural boundaries, how are you finding at least the leadership of the faith community being either helpful or supportive or responsive to each of the issues that you each have brought to the conversation? That would be helpful for me to hear how it's resonating in your own scope of impact and communities that you're operating in.
You directed to Jackie, or?
Well, we can start with Jackie. I did want to hear the responses from Dr. Pacheco and Dr. Lee also in terms of the scope of what they're doing. But Jackie, if you could,
yeah.
I heard you mention the church at least at some point, so that was
Yes.
helpful.
So we have a campaign called the Faith in the Vaccine, a campaign, and what we did is there's gonna be some bad actors, and we have been dealing with that. Personally, I have made some calls to pastors who has been telling their churchgoers not to take the vaccine. And what I just offer is just some facts of what's going on. So we have we are not, and I'm very straightforward. I say I'm not trying to change your belief on how you're gonna run your churches, but this is a public safety emergency that we're going through. But also amplify with the faith leaders that are on board. So we try to put them up front, highlight them story, open up the doors. So our food banks are in 2 churches, and then the vaccine, it was at the Catholic, at the Sacred Heart. So we get our pastor and the leader to come in and send messages, joint messages with us. So yes, so we have both, but we try to amplify the good messengers and get everybody vaccinated. And we reach out to those with the faith in the vaccine. Everybody came on board. Not everybody came on board, but we have a good number of faith leaders that came out from different denominations. So that has helped us a lot on reaching out to our faith community.
Okay, thank you much.
Well, let me just mention, I don't know if this is a good time. Can you hear me?
Yes, I can hear you. Thank you.
This is Senator Pacheco. Well, many communities don't have the benefits that, the Washington, D.C. community has with having the office of the mayor and Ms. Jackie Reyes, who's totally dedicated to expanding vaccinations in this District of Columbia. And you're very right. The religious community plays a very strong role in just about anything that we do in a daily life. And we do know that many churches are very, very active in promoting vaccination, promoting precautions, and because they want their constituents to be healthy and to survive. Nobody wants to lose any of your parishioners' constituency. Oh, but on the other hand, we also know that there are a few, religious leaders, pastors who exactly that. They say, well, the vaccine is made from tissue of fetuses that have been aborted, which is not true, and it's against the Bible, and they don't point out where. And the question is, I would ask them, so you don't have the tetanus vaccine, you haven't had your childhood vaccines. This is no different. So if they speak to a crowd of their parishioners about this vaccine, well, the question is, how many of those parishioners are vaccinated against all of this, many of these, deadly diseases? As children, as adults, we get, the tetanus vaccine. So we have to counter their messages. This is not a new thing. They make it sound like vaccines is a new thing. Also, it does not write back, so it's not going to alter the DNA. And for all that we know, pastors and priests and have expertise in religious aspects, but they have no expertise in science. So where do they come up with the idea that it writes back and can alter your DNA? So we have to counter them, and if it gets to the point where we have to have a debate, that would be fine. But yes, they play a very strong role and a very important role. And where they are promoting the vaccine, they're doing a great job. Fortunately, it's only very few that are against the vaccine. Fortunately, I think many are just promoting vaccine, distancing, everything to keep their populations healthy.
No, I thank you, because that, like as I mentioned, at least in some of our communities, I'm hearing that even global networks, the ministers will bring on doctors who will say to their listening audience that over 500 people have died from this vaccine, or they will say, as you say, the connection with the fetal tissue, or they'll say it's somebody's getting rich off of it. So they'll throw all of those things out there, and to their listening audience, it's impacting in a form of brainwashing, actually.
Absolutely.
Of doing it. So I didn't know if that was what you were also hearing and seeing at times, because where they're getting them from are people who are quote unquote on the media broadcast network, and that's what I was wondering if you all were hearing that too from the
Yes,
scope
indeed.
of those. Okay, and thank you very much.
Unfortunately, I don't want to wish ill will anyone, but we do know. I mean, it's been in the news that some of these pastors who are against the vaccine, against this, against that, who even said that this were not real, have actually died of COVID. Nothing we want to wish on anybody, but it's got tremendous consequences, these messages.
Yes, it has.
Yes,
and thank you very much. And Dr. Lee, I didn't know
that
in the trafficking aspect, what you have found for the support for dealing with the trafficking piece, because I know that that's again, as you point out, very sensitive area, and how that's addressed. I didn't know what your experience has been as far as the faith community and the leadership in particular in helping to address that over the years that you've been working.
One of the things done by the Department of Justice is they have brought people of faith and churches together in order to address the needs of these children. And women of many different denominations have pulled together to set up small homes for maybe just a few as 6 children to live with them. And we're helping them with education by providing the high school equivalency tutoring through Zoom. And they have the unique, already built-in characteristics that make them good at dealing with these children. One being forgiveness, non-judgmental, they're accepting, they provide them with hope, and the love. It's been hard on them because they were sold a bill of goods. How many of these children are running from dangerous men, and they're saying, help me, I want to change my life. And then when they meet them, they may be spitting at them and cussing, and they call and they go, Lois, this is not what we were told. But we're working with them, we're teaching them, and I welcome them, because I think that the solution to helping victims will be done ultimately by small church organizations, the women of the churches, and I think that you have the built-in fundraising through the actual church itself. So I'm happy to see that, and I don't think big organizations should be addressing this. I don't think we need a YWCA in order to address the care and education of trafficking victims.
Okay, that's helpful, because when I'm on the streets of Delhi and Addis Ababa and those areas too, I'm hearing the faith community just a different way. So I didn't know if you were seeing that also in the other countries too.
Yes, yeah, all over the world. In fact, the orphanages or the homes where we're providing the online education globally are all Christian homes.
Okay, okay. Thank you very much, and I appreciate your feedback.
Thank you.
Yeah. Any more questions? Olivia?
Nope, no more questions. Back to you, Christina.
Okay, wonderful. Yeah, so thank you so much for joining us and speaking about this issue about COVID in Latinos. And then we have our third panel to take up the topic on decompression, recovery, and post-COVID world, immigration, which is a big topic for our crowd, our community. And now to introduce our next speaker, Randy Capps, now heading the sociology team at the Migration Policy Institute, has conducted for a better 2 years, interviewing countless high school students of Latino heritage on their psychological and pragmatic responses to the enforcement of ICE during the past few years. The 72-page report is available on the MPI website and describes the human side of policy. And I would like Dr. Randy Capps to present his this description of that report. Very interesting. And so the floor is yours, Dr. Capps.
All right.
Finally, thank you for joining us at the very beginning. And here we are at 2:38 and you're still with us. Thank you so much. And I hope you can stay for the duration of the program, which lasts at 3:30. We have one more speaker on education. Okay, thank you.
Sure, of course. And thank you, Christina and Olivia, for having me. I'm going to share my screen, and as I do that, I'm going to hopefully go back to the PowerPoint. Can you see the PowerPoint title slide?
Mm-hmm.
Excellent. So I'm actually taking a little bit of a step back in time to 2019 when we collected our data. This is, if you can remember back that far, this is still during the Trump administration and pre-COVID. I worked with professors Berger, Cardoza, and Brayback at University of Houston and Rhode Island College to collect some data on the mental health of Latinx high school students. And I'm also acknowledging my other colleagues at MPI here. We were motivated by the question about the level of fear in immigrant communities and how this level of fear that's related to immigration policy and more specifically to immigration enforcement affected mental health in terms of certain conditions that we measured. We measured depression, anxiety, and post-traumatic stress disorder, or PTSD. We also looked at other stressors, and these will be common enduring stressors in Latino communities like other low-income communities, including perceptions about discrimination, forms of economic hardship, and the trauma that people experience day to day in these communities, trauma related to poverty and violence. We looked at how symptoms differed by gender and also between the first generation, those are the students who were born outside the US, and second generation, the students born in the US that have immigrant parents. And we had very different environments where we collected the data. Texas and Rhode Island, a southwestern state with a very conservative political climate. The state had passed a law that required the local police and authorities to cooperate with the federal authorities in arresting and detaining immigrants. And Rhode Island in the Northeast had a governor's executive order prohibiting that cooperation. So the level of enforcement activity at the time in 2019 was much higher in Texas than Rhode Island. And then we also spoke to people in the schools and the communities to see the kind of messages that they were giving about immigration enforcement, the degree to which the schools were able to hire culturally competent staff and train them, disciplinary practices and leadership. So We visited 11 schools. In Texas, we visited the Houston area, and Rhode Island, several small cities across the state. We assessed about 300 students with questionnaires. These were self-administered questionnaires. They were not asked their immigration status because that was considered too confidential and too risky, and the schools never asked that. They're self-administered, so we didn't do a clinical assessment of mental health, but instead has a series of questions that have been used in other studies with young and adult populations to assess how many symptoms of these mental health conditions they have. Of the sample, most of them, they all had parents born in Latin America, and most of them in Mexico and Central America, which we take as a proxy for exposure to having a parent who's an unauthorized immigrant, or being an unauthorized immigrant themselves if they're actually born outside the US, which half the sample was. Slight majority female, and a quarter were over the age of 17. So, you know, the big picture around this, and this has been documented in nationwide surveys. The Pew Research Center did these surveys a number of times and asked the same question. A large majority of this sample was afraid that someone that was close to them would get deported. And this was common across the sample, regardless of whether they were foreign or US born, although it was a little higher among the foreign born, which is understandable. It was a little bit higher in Harris County, where enforcement was more common, but also high in Rhode Island. A third of the sample actually were afraid that they themselves would be deported. This was primarily among the foreign born, but even some US born citizens who by law can't be deported were afraid or worried about it, which tells you the degree to which this fear kind of almost irrationally could permeate the young Latino community at the time. Half the sample knew someone who'd been deported, whether that's a parent, a family member, or a friend, someone close to them. And this again was higher in Harris County than in Rhode Island, but it was higher among the US born. So the US born, you know, they have parents who've been in the country longer. They'll have more family members who are susceptible to deportation. And this isn't the only measure where we actually found more concerns on the part of the US born youth than the immigrants. And then we asked a series of questions about whether or not people would change their routines or behaviors because they were afraid of being arrested or afraid that someone in their family would be arrested. And a pretty high percentage of the sample, about a quarter, that changed their activities in one of these 6 ways listed here. These are things like being afraid to drive, being afraid to go out, important when you're thinking about, you know, what we've been discussing earlier, going to a health care facility or clinic, taking a different route to school. And this was a new set of questions that really hadn't been addressed in surveys before. We were really concerned that these would be the students who had the worst mental health outcomes. We looked at the number of traumatic events these youth had experienced in their lifetimes. They were very high, over 7 on average, which is higher than a lot of other studies of high school students have found. Here we were shocked actually that the US born students had experienced more trauma than the foreign born students, in the form of being separated from a family member, having a loved one die, being assaulted, witnessing assaults or violence. You know, I think what this is telling us in the Houston area, in Rhode Island, in the low-income communities that where we did the research, is that there's a lot of violence and trauma. You know, we hear about it and we read about it in other studies, the violence and trauma that migrants from Central America experience in their home countries and on the way through Mexico. What we found was there's just as much trauma in the communities they live in here in the United States. And I think that's really something that, if we come out of the pandemic, we've heard about rising levels of violence during the pandemic, rising levels of gun violence, higher murders last year than several years before. All those things are going to be heavily concentrated in the low-income neighborhoods where immigrants live. Perceived discrimination. We also asked a series of questions about whether they perceive that they've been discriminated against in certain areas. And here we had another surprise, which is the share of reporting discrimination was actually low in our sample. And here's where, when we spoke to people in the schools and the communities, they were saying that actually being in a segregated, heavily Latino school, you know, most of these schools were 3/4 or more Latino students, being in segregated communities was actually somewhat protective, in that the students didn't come into contact with people from other racial and ethnic backgrounds all that often, kind of a protective bubble that, if you were, would get pierced if they went out into the workforce, when they went on to college, et cetera. And the most predominant form of discrimination was not racial, ethnic, it was language. That the students who had been, felt they'd been discriminated against because their English was poor was one of the most common forms. So now if we look at the share of the students who reported symptoms consistent with one of these three conditions, anxiety, PTSD, or depression, it was much higher among those who were worried about deportation in their family and among their friends. And you can see here very, very high shares. The shares reporting these symptoms was even higher if they were in that group that I showed you in the earlier slide that changed their behavior, that stopped driving or took a different route to school because of fear of enforcement. So when that mental health condition actually started changing their day-to-day behavior and limiting what they felt they could safely do, this was associated with poorer mental health, and strongly so. We sort of put the data together to see which factors stood out as the ones that were most closely linked to mental health conditions. It was these I just showed you: changing behavior due to fear of deportation and the perceived discrimination, which was the strongest. Even though they were a small share of the sample, those reporting discrimination were the most likely to experience these symptoms, and often these two were related. Like, the students who reported discrimination were also the ones who were most afraid of being deported and most likely to change their behavior, and in turn had the worst mental health. And so that, you know, in the larger context that we've been discussing recently, sort of nationwide, around discrimination and structural racism, a lot of that is linked to the fear of deportation and mental health in these students' minds. And also, what other students have found is that you know, young women, the female portion of the sample, reported higher levels of mental health conditions sort of across the board. We also asked about resilience among the immigrant youth and the youth that had immigrant parents. We found very high levels of personal resilience measured by achieving goals, being able to handle difficult situations. Large majorities of the sample here. Also, large majorities of the sample received significant support from their family members. And so when thinking about what the schools can do, you know, the takeaways are that building on the personal strengths and motivation of students is really, really important. And what we were told in the schools is that a lot of the recent immigrant children from Central America were very highly motivated. They had left very difficult conditions and undergone very difficult journeys, but when they arrived in the United States, they were here, they were ready to work, they were ready to learn. There were difficulties for them, but their motivation was very high, higher than for the average student born in the United States. And those that had strong family support, that was an important source of strength. So engaging the parents, if you will, in the schools, which is always a challenge at the high school level in immigrant communities, is important too. So again, in sum, what we found with the surveys of the students is that mental health symptoms were higher among girls and boys, but surprisingly not higher among the foreign-born youth. As I mentioned, a lot of this is because of the high level of trauma the US-born experience. Not higher among youth with parents from Mexico and Central America who might be undocumented. So it's kind of across the board we find this high share of mental health symptoms throughout the population we studied. And I think the implications of that is that these mental health risks reach very broadly into the Latinx population nationwide. Not higher in Harris County, even though the fear of enforcement was higher. The prevalence of mental health symptoms in the sample was not higher in Texas than it was in Rhode Island, even though Texas is a tougher place in some ways in terms of the political climate. So it was a nationwide, again, this was 2019, things have changed since 2019, but we interpret that as being kind of a nationwide phenomenon. And that, again, that combination of discrimination and enforcement fear was the strongest. We also, in terms of speaking to the schools and communities about what can be done to support students' mental health, very important to have policies, whether they're announced by school leaders, principals, and others, or they're written policies to protect students from ICE coming on campus, and you know, having written policies potentially about this. But it's difficult to do in a situation when you're in a state like Texas and it's prohibited by law to have a sanctuary policy. There are limits to what school leadership can safely say. So that was a challenge. Developing, supportive adults in schools, recruiting, bilingual, bicultural staff, faculty, that's always a challenge for the public schools. Limited supply, not necessarily the best working conditions, et cetera. And so some of that was also being able to train people who are from a less from say an Anglo background, and in ways that they could be more approachable and more understanding of students. It was really important for there to be at least one caring adult in the school that students could go to talk about their issues. Now that could be a mental health counselor, but again, that's in short supply. It could be a social worker. There's a real crisis in terms of mental health provision in the public schools. Again, this predates COVID-19. It's certainly probably gotten worse since then. But the schools, particularly in the Houston area, were good at getting into partnerships with local universities, hospitals, other healthcare providers, CBOs, to bring counselors in on a rotating basis, to have interns from school social work, for instance, to help supplement the resources. In terms of developing opportunities for leadership, by there I mean, grassroots organizing groups, advocacy groups, the opportunity to take issues that are personal and local, meet with other people who are experiencing the same thing, talk about it in smaller groups, and then eventually get motivated enough to go and lobby to the mayor's office, lobby to the state legislature. And there are a number of examples of students who had mental health issues who were at least able to function better, if not somewhat overcome those issues by being involved in these leadership programs. And then, of course, engaging parents and providing leadership opportunities for them as well. So, as I mentioned, the research occurred in 2019, and the world has changed since then dramatically, right? So now we have COVID-19, and as was mentioned earlier by Dr. Pacheco, we've had higher infection rates in Latinx communities, and immigrant communities generally, higher exposure because of essential work that these families do. We've had greater economic hardship because of layoffs, et cetera. And then we had the virtual schooling and the social isolation that goes along with that, which has affected everyone to some degree, even my own high school students, right? And so as we come out of that, there are more mental health challenges than we were facing before as we restart. On the other hand, we have a new administration, and even at the last year of the Trump administration, because of the pandemic, ICE deported, arrested, and detained far fewer people. They didn't want to put their own officers at risk. The detention centers were major vectors of the disease, and they really dialed it back in the last 6 months. And then Biden took over, and we've had an even greater drop since then. So we're in a different climate, like from an immigration policy point of view, than we've been in for 15 or 20 years. ICE arrests are at their lowest levels since probably 2004 or 2005, like lower than they ever were in the Obama administration. I don't think most people realize that. And this public charge rule you may have heard about, which is that someone who wants to become a permanent immigrant to the United States, who's here temporarily or unauthorized, they apply for a green card. Under the Trump administration, they put a rule into effect that they could be rejected if they apply for Medicaid, for instance, if they apply for food stamps. They were able to successfully overturn this rule at the beginning of the Biden administration. This should also help reduce the fear level in terms of accessing government services, and this should apply to the vaccines, of course, to getting health care, et cetera. They've opened the border to more family and child asylum seekers who were completely kept out in the last couple of years of the Trump administration, and they've changed the rhetoric. They banned the use of the term illegal alien, which had been required in all government correspondence under Trump. It has now been banned under President Biden. So the rhetoric has changed. So the question is then, how does this message get out? How do we use this message to try to overcome, to improve access to services, whether it be COVID vaccinations, mental health, going forward as we come out of the pandemic and as we hope things return to normal, and as we hope things return to normal in a climate that's a little bit more benign for immigrants than it was before the pandemic. So this is me at migrationpolicy.org. We're a Washington, DC based think tank, but we study migration globally. We have a data hub if you want information on immigrants locally or nationally in other countries. And then the report that Christina referred to and other resources on this study are at the bottom of this page in terms of where to find them. Thank you.
Hi, Randy. I think your report's excellent. Is there going to be any follow-up, any kind of action by legislation? Does this go anywhere? Can we change things?
Yeah, so some of this is at the local level and some of it's at the national level. So my colleagues at University of Houston and Rhode Island College have been working with the schools on helping develop mental health resources for years, and they're very active on that. Kalina Brabeck at Rhode Island College issued a policy brief to the state legislature to get funding for alternative forms of discipline, shifting money out of disciplinary, harsh disciplinary practices that could put students who are immigrants at risk for deportation, but also can be generally harmful to students. You've probably seen in your world.
Yes.
And shift those resources to counseling and support for mental health. And they were able to get something in the Rhode Island legislature about that. Now, of course, Rhode Island's a relatively progressive state, smaller, easier to do activism in. We hope that can be done in other states as well. And then, of course, for the schools to adopt policies. And my colleague at the University of Houston has been very active in getting the school districts there in that area to also devote more resources, and has herself done mental health counseling in the schools and trained her students to do it. So there's that. Now, at the nationwide level, it's all about making the case that these policies are harmful. And ultimately, of course, we would say, like others, researchers and many advocates would say, a kind of a legalization, a change of status that would give people some security. Even if it doesn't lead all the way to citizenship, at least if it reduces the risk of deportation, would be hugely beneficial, not just economically, but to mental health. That doesn't appear to be in the cards right now. We have a gridlock Congress on a lot of things, and a border crisis that makes it worse when it comes to immigration. But we've seen a lot of pressure, and the Biden administration has hired a lot of, I would say, the right progressive people to dial back immigration enforcement. And we've seen that happen, within the first few months. We've seen the reversal of, I have another presentation that talked about almost 100 policies that have changed already under Biden in 4 months on immigration. Many of them related to changing the rhetoric, making things efficient again, making it possible for people to get the immigration benefits they're entitled to by law, and kind of dial down the rhetoric. So there's a lot. We're part of that conversation. I wish we could do more on this particular issue. As you know, mental health, it's difficult, it's underfunded, but we hope we're part of that conversation.
Okay, that's very nice. Now, I think you had some questions, Olivia.
In a pandemic, should current research-generated know-how and cutting-edge knowledge readily be shared among national and international firms and states?
Cutting-edge research be shared is the basic. I agree. I mean, I think we do our best at MPI to get information out quickly. I mean, I think one of the issues with the pandemic has always been keeping pace with what's been happening. In the case of this particular study, we were about to go live with it and have an event in last March, which kind of threw a wrench into things, and it's better to have information that's up to date with the current situation. I would completely agree with that. But that's certainly what we try to do is to share information, and also just to create collaborations among researchers. And we do a lot of that internationally at MPI. Right now, we're very engaged in an international conversation around refugees. The refugees and asylum situation in Europe, which is analogous to what we're facing here with people trying to come from Central America and increasingly from other world regions. Setting up asylum systems and refugee options in Central America and potentially in Mexico. I mean, that's a really important conversation. So we're constantly trying to share the findings that we have from research that's been done in other countries to inform our policies here in the US, which US audiences are not always that receptive to it, but we try, and vice versa. So I mean, I think that's a really important question, so thanks.
Will the jolt of a pandemic generate a long-term change in economic public finances practice for pre-K through high school? And will it enhance educational models, come to
That directed to Dr. Capps or is it directed to somebody else?
It was submitted. It doesn't say who.
Oh, okay. So
I mean, it sounds like your next speaker might have a little bit more expertise in this.
yeah,
I will say that if you visit the website, we actually have our Immigrant Integration Center has done a lot of work on education for English learners during the pandemic and concerns about their access to technology, to, you know, just to their teachers and learning. Very much focused on pathways to learning English and getting the same level of content instruction that you know, native English speakers get. That's always been their concern. It's been worse during the pandemic. I don't know that research very well. It's also possible that they may have uncovered that virtual learning can actually help English learners in some way. There may be some advantages to it. So I would visit the website for that. And if you can't find it, we have a couple of experts on the education side that have looked into this that I could put you in contact with. I think it's a really important question.
Well, thank you, Dr. Capps, for the engaging account of the significant research on immigrant Latino teens in this country. And so we now have our longtime friend, Giselle Londe-Ponce from the American Federation of Teachers, a frequent dialogue speaker, will describe to us reimagining public schools post-pandemic. The key to relief from much of the boredom of our own day lies from the face of decompression as workers and students begin to return their energies to a new, busy, and now smartly turned out school system. Giselle describes an educated image of a school of the future. Giselle, the floor is yours.
Thank you so much, Maria Cristina, and thank you to my fellow panelists. I put in the chat our website on resources for English language learners on that question that Dr. Capps got earlier, and we reference a lot of information done by their very own analyst, Dr. Sugarman over there at the Migration Policy Institute. So we're happy to cross-reference and always pass on the good word. So let me share my screen and share my slides. And so what I'm about to share with you is our policy agenda going into the fall and going into post-pandemic world in the United States, at least. And I'm with the American Federation of Teachers, like Maria Cristina Caballero said, and the AFT is the second largest teachers union in the United States. We represent educators mostly in our large urban cities. Anywhere from New York City to Chicago to Los Angeles to Miami, Detroit, Houston, never a dull moment, never a dull moment. So what are we looking at coming in? Our philosophy is that our schools need to reopen. We know, and this is going to mirror some of the same information that Dr. Capps went over. So I'm not going to spend too much time over all of these points, but we know that there's been a lot of trauma right there with learning in an isolation mode with technologies that were new, that we're still learning about. We have been missing the interactive element for children and for our earliest learners, that relationship, that developmental need to have those nurturing interactions with educators and with adults has been missing. And so we also know that schools are also a hub for the community. And so we know that our families many times count on schools for their primary meals. So for all these reasons and many more, we are a political organization, and we enthusiastically endorsed Joe Biden for the presidency during the election. And we are just thrilled to know that they have begun to just deconstruct all the different structures that were set up during the Trump administration that were set up to hamper education, public education in particular. And so we know that we have allies now that are advocating with facts, not fiction or fantastical, magical thinking around things. And we know that there's transparency with this administration, and that there is funding to go along with the great ideas that the Biden administration is proposing. And so we see that today we have 97% of schools that are open, either full or part-time. So this gives us great hope as we go into summer and the fall. And of course, we know that there's more to schooling, more to public education than just being physically in school. So we're going to have to turn to the recovery and what that's going to entail, socially, emotionally, academically. And when we think of reimagining what public education can be, these are ideas that we have been proposing for very, very long, and that we hope will finally materialize in one way or another. And so we want schools that really foster children's passion for learning, that builds their confidence, where they become critical thinkers, where they're not just prepared to take exams and assessments. We want them to thrive, and we want our educators to be in a school where they want to teach, not where they're overwhelmed with filling out paperwork, not having the resources or the tools to do their jobs. And we are talking all children, rural, urban, suburban, in Bureau of Indian Education schools, in our Department of Defense schools abroad, in early childhood education centers. We want them to be able to reach their potential. And we are really just not going to back down from continuing to fight for adequate college preparation, for career and technical education. We're coming into a new era. Higher education does not look the same way it did when I started going to college. And civic participation is so important. We really need an infusion of real dialogue, real debate, real history being done in our schools. Otherwise, I think we'll be up against the threat and the danger of what we saw happening on January the 6th. So in essence, we are proposing a renaissance for public education. And there are scholars who are much well-versed than I am in the Renaissance that we saw happening in Europe, the Renaissance that we saw in Harlem with the arts and letters. And we want to see just an explosion of the kinds of programs and schools that get children and youth motivated to be in school, that really gets at their life's passion, that validates who they are, that brings out the best in them, and that the community can come together around and make our public education system the best system in the world as it used to be at one point. And how are we going to do this? So we know we talk lofty ideals. We have, just a very visionary attitude towards what needs to happen. But when it comes down to it, as a labor union, where does the rubber meet the road? And with us, it comes through the power of collective bargaining that we are going to be able to achieve many of these things. It comes through participation in school board meetings, and not just us, but many of the stakeholders, parent groups, community groups, national organization, local organization involved. And it comes through legislative hearings, letting our Congress hear what needs to happen in schools and how urgent this is. So, we are proposing just any number of improvements right now. We want to see upgraded school libraries with high-speed Wi-Fi. We know that, this was really, I think the pandemic only intensified the great gaps out there in terms of what's needed. We need a lot of CTE programming, that's career and technical education. Again, just like higher education is not your granddad's Oldsmobile. CTE programs look very different now than they did when it was just vocational ed or woodshop. They are very sophisticated, in fact, and they can be a real hub of innovation and a source of uplifting and creating a new middle class. We want to see our buildings being upgraded for new ventilation systems, new structures, and we cannot say enough how much we need enough mental health services for our students and for our staff. Right now, we are hoping that many summer programs don't just focus on academic support, which will be greatly needed, but also on project-based learning, on experiential learning, where students are getting their literally getting their hands dirty, doing gardening, or doing community service projects, or learning about robotics, just something that will begin to phase them out of the pandemic mode of just staring at their screen and really getting them out and about, and bringing back that joy of learning and motivation. We know we have to help our educators take care of themselves too. Not every one of our teachers is going to be enthusiastically volunteering to do summer school this summer. So we want to work with new teachers coming into the profession, with other school staff who want to work in these summer programs, and with our teachers who still have it in them to continue going. We know that we have to really reach out to our families in multiple languages. And the collaborative piece is going to be extremely important, and not to mention the advocacy for equity and social justice. We are in a poignant point in our history with a lot of just intense racial reckoning and racial injustice that we have all witnessed and felt, and our public schools need to also benefit from a renewed vision on social justice. And can't say enough also about, I mentioned ventilation before, but also getting rid of lead in school buildings, of asbestos. If we don't mind buildings, we can't build minds. We know that we not only need the right technology coming into the future, but we also need the kind of tech support that's going to help people use it. I cannot tell you how many times we heard from teachers and students that, yeah, they picked up laptops or iPads, Wi-Fi receivers, and then there are very few instructions to learn how to use them properly. And I can tell you that happened to me with my middle schooler when the lockdown went into effect. And I can tell you, my child with two very highly educated parents, we had to spend a whole day figuring out how to log on, how to install when, what to plug into what. And we can only imagine, and we know how challenging it was for many, many families. And actually just droves of students, children and youth, have dropped off the enrollment rolls. And one reason is that the technology was nearly hard or impossible to use. So we need to fix that. And we also want to emphasize the importance of our specialized instructional support personnel, who are our people such as our school psychologists, our behavioral analysts, our school nurses, our school nutritionists. Sometimes there is only one counselor for hundreds of children. And this is not acceptable. This is not what we envision. This is not a school of the future to be understaffed and under-resourced. This is our vision ultimately. And if I have an extra 2 minutes, I would just like to play for you a video that features some of our teachers talking about what they, if they knew then when the lockdown happened, what they know now. It's just a really riveting listen to what they went through during the lockdown. So let me, hopefully this will work. Let's see. And you can hear that? Olivia, can you hear it okay?
Yeah. Yes.
If I knew then what I know now.
Slow down. Don't panic.
I don't want to burn out. So what can I do to continue to go with the flow and adapt, right? While still having a voice.
You're in it for the long haul. I know it's going to be tough, but like if you take these action steps right now, you'll be good.
Give yourself heaps and heaps and heaps of grace and patience and self-care for sure.
Somehow I'm going to adjust to it, and it's gonna become the new normal.
Just worry about what you had to get done today.
Trying to give them a place where they can come and kind of disconnect from what's going on at home and talk to each other. And even if that's not always based on the content we're learning, especially in an ELL classroom, the ability to just make those connections with each other, with me, I think that's the one thing I wish I had started earlier when the lockdown started.
So I just wanted you to hear those very important voices in the front lines. So thank you so much.
Thank you, Giselle, for your brilliant account of a school of the future. Wow, looking forward to it. Next, Olivia will conduct a question and answer session with Giselle, as well as any outstanding questions for any of our great panelists today. Over to you, Olivia.
Thank you. That was a great video and presentation. I don't see any hands raised right now. Occasions of disaster will always be with us. Will today's experience produce a new style and fresh technique of government action?
Yeah, I mean, I think we are much more prepared now than we would have been otherwise. And so it's a little bit like after the few disastrous hurricanes from 2 years ago, including Hurricane Maria. Now, the latest I heard, from FEMA is that they are much more prepared to address, these natural disasters. And as to the pandemic, I can say, yes, I mean, we have baptized a whole generation of educators in a, baptism by fire exercise during this time. And so, yeah, I can say that, yeah, we'll definitely know how to approach, this next event, whatever it might be.
Thank you. And I assume you and your middle schooler are well set with all your online learning now.
Yes, yeah, we finally got it.
It's my time to thank you all. I'd like to thank all speakers, Dr. Lois Lee, President Founder, Children of the Night, Dr. Henry Pacheco, physician, Pacheco and Associates, Dr. Randy Capps, Director of Research, Migration Policy Institute, Jackie Reyes, Director of Mayor's Office on Latino Affairs, and Giselle Lundy Ponce, Manager for Social Justice, American Federation of Teachers, as well as James Robb from MSCI, Mary Barrientos, Olivia Carvajal, Esquire, our moderator, as well as our supporters, American Federation of Teachers, Mayor's Office on Latino Affairs, Microsoft, Verizon, Migration Policy Institute, Girl Scouts USA, Ana Mendez University, Latino Coalition, Unidos US, Capital Wire PR, Southwest Airlines, and many others who have contributed to dialogue in many ways, So if there are any questions, and this is for the general public, we did not take up today, please feel free to contact us at dialogue.div@prodigy.net or leave them in our chat box in the webinar just conducted. A calendar for the year is available at our website, www.dialogueondiversity.org, and watch for September 2nd on economic program, the entrepreneur, the 2021 model. And we expect a live in-person event then How about that? Ambition, right? Finally, December 11th, holiday fair and children's gift collection with Santa at the International Trade Center in Washington, D.C. And many thanks again for joining us while we enjoy the coming midsummer solstice. One last message to all. Please get vaccinated, wear your mask if you haven't been vaccinated, keep safe and stay connected. And we love you all and God bless.
Thank you.
Thank you.
Thank you.
Thank you.